For patients with COPD, we often have two types of blood sampling. We have the venous blood sampling, which is the regular blood sampling that nurses, but the GP is often performing. And on those tests, we evaluate blood cell count, we evaluate renal function, liver function, but specifically to our attention is the blood eosinophil count, which is important as it guides us towards the prescription of a specific inhaler therapy. Inhalation corticosteroids in COPD patients only work efficiently in patients with an elevated eosinophil blood cell count. And that is why blood sampling is becoming more and more important for our patient population. Another blood sampling is the blood sampling in the artery, where we look at gas exchange, meaning that we measure directly the levels of oxygen and the levels of CO2, which gives us the idea how the lung contributes to gas exchange in our patient. This last sampling is sometimes a little bit more painful as compared to venous blood sampling. So venous blood sampling is important obviously because of the eosinophil count that we can directly assess. Measuring gas exchange gives us a good idea in what is limiting the patient during exercise and may also give insight in whether or not a patient needs oxygen as part of his therapy. Both procedures can be done at any time. They don't need any preparation. The only thing is that the sampling needs to be directly stored and analyzed in a laboratory environment. So blood testing and arterial blood gases are expensive tests, but in many countries these are critical tests and are reimbursed, so the cost for the patient is quite limited.